Welcome, greetings. My name is Kathleen Steele. I'm a mental health professional, and I will be moderating this webinar today. First off, I'd like to thank everybody for coming, and thank you all for attending. Keeping everything clean for us and sanitized. It's also very heartwarming to know that we have over 100 participants that are willing to learn and prepare themselves, their families, and to help better prepare their community for this epidemic that's going on. We have received your questions through the registration form, and we hope to address as many as possible. During this webinar, we do have some rules. We do ask that you remain muted. We do ask also if you could type any questions in the question and answer or the chat section. We will be looking at them and try and answer as many as we can. So without further ado, I would like to introduce Dr. Nadia Ali. She is the founder of Functional Integrative Medicine Practice for Functional Holistic Healing. She's been practicing for 16 years, board certified in internal medicine specialty, board certified in integrative medicine, a fellow of the American College of Physicians, a member of the Institute of Functional Medicine, and many other certifications. You can learn more about her practice and her other certifications at www.theholistic.healing.org, and it is at the bottom of the slide if you would like to keep on to that. Dr. Ali's compassion, knowledge, and commitment is very apparent when she's working with clients. I was personally able to see that when she worked with my mother. My mom had been very sick and she was trying everything, really working hard at changing her habits and her eating. Once she started working with Dr. Ali, we started seeing improvements right away. Within a year, she had more energy than her friends and myself. It was pretty awesome. So without further ado, I would like to know, and I'd like to ask Dr. Ali, why did you feel the need to organize this webinar for your patients and the community at large?
So basically, if you look at the nations that have been successful at overcoming this pandemic in a very effective and efficient way, you will find two lessons that we can actually learn. The first lesson is that the nations were very well aware. And when I say they were aware, it was not just the leadership. It was not just the healthcare professionals in that country. But everybody, every citizen was very well aware of what their role is. They knew how grave the issue is. They knew what they needed to do if they have any symptoms. And they knew how to seek help if they get into trouble. So if we really want to address this pandemic, it is extremely important that everybody is aware of the bigger picture and what is their role in it. So one of the most important aim of this webinar is for us to be able to know what the bigger picture is, because there's a lot of information which is very confusing with regards to testing, treatment, so on and so forth. The second thing, which I think is equally important, is that we need to know that a pandemic is a war situation, which means that you will either lose together or you will win together. So if you really want to win, then we have to come together as a team. We need to work together. We need to support each other. And we need to know that without extending our support to others, irrespective of how we do that, whether we do it emotionally, financially, physically, it is not possible for us to overcome this. I have no doubt that we can get through this. I actually feel that when we get through this, we will come out more strong, more resilient, and actually more prepared for the future. But this is the time when we have to come together. And this is our first initiative in terms of raising awareness and developing connection. However, this is not the only initiative. There are two more initiatives that we plan to take. The second initiative is called Awareness Tribe. over 100 participants who actually registered through the website indicated that they wanted to be part of a group where they could kind of connect and develop themselves, learn how to cope in this distress, learn how to develop their immune system. And so we want to create this group which can come together, learn together, and share what they have learned with each other. The third initiative that we are planning to launch is called COVID-19 consultations. And we will talk more about that initiative as we talk more about COVID-19 and how to address it, how to deal with it. So those are some of the things we plan to do in order to help our patients and our community.
It's definitely important to work together and give a smile at this time to one another. And one of the second question is, one of the biggest issues is the rapid rise in the number of people getting infected with COVID-19. How is this virus transmitted?
So I thought this was a very interesting cartoon. I do not personally approve of this form of social distancing, but I have a question, and I think that's an interesting question. Imagine that this person here actually has COVID-19, and he's gone to the pharmacy to get some medication, and the distance between this person and the pharmacist is about 6 feet. And if we assume that this rod is sterilized and it's disposed of properly, do you think that this pharmacist is exposed to COVID-19, or he is not exposed to COVID-19 because he has maintained his distance and he has not directly touched the patient? So I'm going to start the polls right now, and I want you to tell me, what do you think? Is this pharmacist exposed to COVID-19 or not? Yes, no, or unsure? So let's see. I'm going to wait for a few minutes for everybody to be able to let us know what they think. So I'm going to end the polling right now, and I'm going to share the results with you. So if you see this, there are about 74% of you who said that yes, the pharmacist would be exposed. There's 3% who said that they don't think that's the case, and 24% are actually not sure. And so we'll talk a little bit more about exactly what is happening in this situation in just a minute. So if we go on to next slide. We know very well that one of the primary ways we communicate the disease is through a person who is infected, who is coughing. And so the secretions from the mouth, the secretions from the nose actually spread the virus. But that is not the only way of transmission, because we know that when you are infected, it takes between 2 and 14 days for you to develop symptoms. During that time, you are multiplying that virus in your body. And so you definitely can transmit that virus. And then there are 25% of individuals who will never get any symptoms after getting infected. And so they don't know when they had the infection and when the infection resolved. And during that time, they are shedding the virus at all times. So basically, COVID-19 can infect you from a person who is symptomatic and who's not symptomatic. So the truth is, just because somebody does not have symptoms does not mean that they are not transmitting. As far as the scenario of the pharmacist and that patient is concerned, what we know now is that if that person who came to the pharmacy sneezed, the virus will actually remain in the air for about 3 hours, which means that the pharmacist may actually get exposed even though he is 6 feet away. And anybody else who enters that pharmacy, because remember, the pharmacy is a closed space and there is not necessarily going to be a good ventilation system in that pharmacy. So it means that whoever enters that pharmacy in the next 3 hours will also be exposed to COVID-19. So not only is that the only way, we also know that COVID-19 actually survives on surfaces. So it survives on copper for 4 hours, on cardboard for 24 hours, on plastics and stainless steel for almost 3 days. And that's on an average. So if you are around anybody who has the disease or who actually has exposed a particular surface, you are still at risk for contracting it. The other misconception that we have is that if you put something in the refrigerator, automatically you can get rid of COVID-19. That's not true, because it can stay in the refrigerator for up to 2 weeks. So that is why it's extremely contagious, and we have to be extremely careful in terms of making sure that we protect ourselves.
Thank you so much. And also, what are some of the symptoms that we should, or that patients would experience if they are infected with COVID-19 virus?
So I think before we talk about transmission, I think one of the things we should talk about is how are we going to reduce the exposure. So there are some of the things that I want to make sure that we are well aware of. We already know about the 6 feet distance. But the other thing which is extremely crucial is the mask. When you are leaving your home, you need to have a mask on. You don't know who are the people you will encounter, how many people you will encounter, whether they will have COVID-19, not have COVID-19. So you need to have the mask on. If you have disposable gloves, make sure you wear the gloves. You wear them, and when you're entering a place, after washing your hands, you wear your gloves, you enter, you go around, get whatever you want. Once you come outside, you dispose the gloves and you wash your hands again. Washing your hands, important to remember, 20 seconds at least. Last but not least, remember that if the virus gets on your skin, that's not a problem. But if the virus gets from your skin to your nose or your mouth or your eyes, that's a problem. So make sure that you wash your hands before you touch any of those surfaces. That is critically important. The other thing is disinfecting all surfaces. If you're bringing something from outside, it has to be disinfected. If it is something that you don't need to use right away, you can leave it in a remote location, like in your garage or something like that, for about 3 days, and then you can use it. As far as produce is concerned, according to FDA, there is no data that COVID-19 is actually spread through food, which is a good thing. However, if you're bringing produce, then wash it with cold water to remove pesticides, insecticides, any kind of germs that it may have. If you are getting something delivered from a restaurant, try to get things which you can heat up. In case if there's any contamination, you can always heat the food at 140 degrees for a few minutes, and that would inactivate the virus. So these are some of the things that you can do to protect yourself from COVID-19. Now, as far as the symptoms are concerned, there are 2 types of symptoms. There are typical symptoms, which are what is commonly known, and a lot of patients who get COVID-19 may experience those symptoms. And those symptoms are fever, dry cough, and shortness of breath. However, you do not have to have all of them. You could have one of them as well. But there is another set of symptoms which we call atypical symptoms, which means that those symptoms may not be that common. However, it is important to know what they are, because if you have them, then you should start thinking if what you experience could be COVID-19. And those symptoms are, number 1, loss of smell. That is a very interesting symptom. And we have found that a lot of people complain of that symptom before all the other symptoms begin. So if you have loss of smell, that is something that you should be vigilant about monitoring. Second thing, we often talk about dry cough, but actually 33% of the people who had COVID-19 had phlegm production. 5% of population actually had gut symptoms like nausea, vomiting, diarrhea, bone pain, joint pain. fatigue is one of the symptoms which is very prominent. The patients whom I have seen with COVID-19, they had a significant degree of fatigue. Not only did they have fatigue, but the fatigue also lasted much longer. So even when all the symptoms actually went away, they still continued to have fatigue. So that is something to be aware of. A lot of times we brush off some of the symptoms, like if one of my patients who had COVID-19, she had some fatigue and she thought, oh, it's probably because she was stressed out. So do not brush off your symptoms. Pay attention to them. Loss of appetite is also experienced, chest pain, chest tightness, running nose, nasal congestion, and sore throat are other symptoms that you can have with COVID-19. So you can clearly see that the presentation of COVID-19 is very diverse, and different individuals will have very different presentations of COVID-19. The other very interesting thing about COVID-19, we have found, there was a study done at Stanford University, and what they found was that 1 in 5 individuals who had COVID-19 also had another viral infection. That could explain why the presentation is so diverse. So, because a lot of viral infections also cause phlegm production, they also cause loss of appetite, they also cause fatigue, joint pain, bone pain. So just by the symptoms, it's very hard to tell if you have COVID-19 or you have influenza or you have parainfluenza. So the history of the patient may not necessarily always tell you exactly what's going on. There are also symptoms which we call severe symptoms. If you have any of the severe symptoms, it is extremely important that you call 911. These symptoms basically indicate that some of your critical organs, like your heart or your lungs, is now overwhelmed. The symptoms are if you have trouble breathing, you feel chest pain or chest pressure, which is not going away, you feel that you're getting confused, you're having a hard time staying conscious, you're feeling drowsy, or you have blue lips or face. At that point in time, you have to call 911 because you need to be in the ER right away. So if there is one thing that I think we should take home is that listen to your body. When we are in distress, we often don't listen to our body. And I know it's a difficult time for us, but listen to your body. If you have a new symptom, pay attention. Think about it. Why do you have that new symptom? Monitor that symptom. See what else is happening inside your body. Because the earlier you are able to catch it, the earlier you can do something about it, the more chance that you will be able to fight it better. So listening to the body is the key.
Could you tell us what percentage of those infected individuals will experience severe symptoms? And also, who are the people most at risk for developing severe disease or critical illness?
So the good news is that 81% of those infected will have only mild or moderate symptoms. There will be 15%, about 15% of them who will have what we call severe symptoms. And the reason why they have severe symptoms is that more than 50% of their lung is infected, which means that at that point in time, their oxygen saturation might start going down. So we need to get them to the hospital. They will need additional oxygen support, and they will need support for other organs as well, depending on how many organs have been affected. And then 5% of the people will be critically ill, which basically means that they will land in the ICU because their systems have actually failed to the degree that they can no longer support themselves. So as far as who are at risk is concerned, the people who are going to be at a very high risk of developing severe disease are people who are over 65 years old, also those who are living in nursing homes or senior living facilities, individuals with medical conditions, and those conditions are diabetes. If you're a smoker, not only do you have a higher chance of developing severe disease, you're also at high risk of dying from it. You have heart disease, you have any kind of underlying lung disease, whether it's COPD or asthma. If you're someone who has had cancer and is on a therapy for cancer like chemotherapy, you're a transplant patient and you're on medications which suppress the immune system, patients who are using steroids for the underlying conditions, if you have liver disease, if you have chronic kidney disease, if you have HIV or other infections which lower your immunity, obese patients with a BMI of over 40, and also pregnant women. So pregnant women, basically the reason why they are at risk because they can transfer the infection to the baby, and that would lead to growth retardation and other complications in the baby. And that is why they need to be very vigilant about not exposing themselves.
So that sounds like good news that most have mild to moderate symptoms. So what if someone has mild to moderate symptoms? What should they do?
So the first and foremost thing, if you have any new symptom, is that you go ahead and call your physician. Because the most important question that we have to discuss with the physician or our doctor is that, are these symptoms actually indicating that I could have an underlying COVID infection? The second question would be, do I need to be treated? Or do I need to be tested? Or what do I need to monitor in the next few days to make sure that I'm not going from mild to moderate to more severe form of the disease? So those are the questions that you have to ask your physician right away, as soon as you think there's something not going in the right direction. So do not wait. Pick up the phone, discuss it, so you know exactly what you need to do.
You had mentioned COVID-19 consultations earlier on. Is this for your patients?
No, COVID-19 consultations are not for our patients. Our patients can just call and we can schedule their follow-up within 24 hours to kind of discuss what symptoms they're having. We had a lot of our patients request that they would like us to help their loved ones and their family members who are either at high risk and they want to know what kind of changes do they need to make in their lifestyle, or what kind of nutrients they need to be on, or what kind of botanicals can they take to strengthen the immune system to reduce the risk of severe infection. Or individuals who actually have been infected and they have already quarantined themselves, but they want to know what can they do to overcome the symptoms that they're having and how can they make sure that they don't go from mild to moderate to severe. So what kind of support can they get, both in terms of vitamins or minerals or herbs? So that is for those individuals. So the COVID-19 consultations is for patients who would like to seek help who are not our patients currently.
That's really good to know that there is help for COVID-19 and it's available. So let's talk about the testing. What type of testing is available at this time?
So basically, when we talk about testing, I thought this was something very interesting. Our toilet papers cannot protect us from testing positive. But there are two types of testing that is available. The first is called PCR. And PCR is basically looking for the genetic material of the virus. So RNA is the name of the genetic material of the virus. And basically, this test actually tells us if there's an active infection going on or not. The problem with this test is it's only positive in 70 to 80% of people, which means that in about 20 to 30% of the people, the test will be negative, even though they have COVID-19 infection. So the current testing that's going on is the PCR testing, where they take a swab from the nose or the throat. And a lot of places now have the drive-through where you can go and get yourself tested. In a lot of these places, you will have to have a note from your physician that you need to get the testing done. However, there's a limitation, like I said, that if it is negative, it does not necessarily mean that it is negative. So you will still have to do what you would do if you had COVID-19 test for PCR positive versus negative. It will not change. The second type of testing that we have is what we call serology or antibody testing. The serology or antibody testing is right now in the process of being introduced. The problem of this testing is that it can tell you that you have had an infection with COVID-19, but it cannot tell you whether that infection is going on right now or have you already had that infection in the past. Also, the other problem with this test is that it may be negative early on when you're actually having symptoms, because it takes time for the body to develop antibodies. So this test may not be positive early on. However, if you have had infection in the past, you could not do the PCR testing, and now you want to know whether that infection was COVID-19 infection or not, you can go ahead and do the serology testing. It appears the serology testing is very much easier and might even be done at home through like a finger prick. We are still waiting for that test to be out in the market. And that might be helpful for a lot of people who were not able to get tested, but want to know if they actually had COVID-19 infection or not.
So who should get tested right now?
Ideally, everybody with symptoms that are possibly COVID-19 symptoms should get tested. However, we know that we do not have the resources. And so what CDC has done is it's given us a model to help us prioritize. So according to that model, priority 1 is for hospitalized patients and patients who are symptomatic healthcare workers. The second priority are people who are at high risk. So those in long-term care facilities, people who are 65 years or older, those who have underlying conditions which predispose them to having more severe disease, and first responders with symptoms. And the third priority are people who have either mild or moderate symptoms, critical infrastructure workers with symptoms, healthcare workers, first responders. So that is currently what the priority is. The best thing is to call your physician to have a discussion about what your risk is for getting a severe infection and whether you need to be tested or not. So that if you need testing, you have to get it done as soon as possible, simply because sometimes it's taking between 5 to 8 business days to get the results. So the earlier you do it, the better it is.
What are the treatments available for those infected with COVID-19? And is there anything we can take to prevent the infection?
Well, basically, one of the important things to know is that there is currently no medication available to prevent infection. No medication. It means that please do not take Tylenol just because you think it will prevent the fever, or don't try any medication which is claimed to be very helpful, because there is no medication like that. We do have vaccine trials ongoing, but there are a lot of questions which need to be answered. First, how effective is the vaccine going to be? Second, how long will the effect of the vaccine last? Third, who are the people who it would actually work for? So until unless we get answers to those questions, it is very hard to make an informed decision who would actually benefit from the vaccines. There have been a lot of claims that have been made with regards to the medications such as hydroxychloroquine, remdesivir, that they're very effective. Unfortunately, there is no evidence. We have no robust evidence to show that these medications actually work. And we have some case reports, meaning there were some cases in which these medications were used and they appeared to be beneficial. There are a lot of trials that are ongoing to figure out whether they're effective or not. However, we have to understand that they are being used in very severe cases. And the reason why we're only using them in severe cases is because the side effect profile of these medications is not great. So for example, if you look at hydroxychloroquine, which it's been claimed that it's great and it's really effective. If you look at the side effect profile of that medication, it can cause liver damage. It can cause damage to the vision. It can cause heart failure because it's directly toxic to the cells of the heart. It can cause serious arrhythmias, which can lead to death. It can cause hair loss. It can cause changes in the color of the skin. It can actually cause bone marrow suppression, which means that you can get anemia because you will not produce red cells. You can get infections because your white cell count will go down. And you can get bleeding because your platelet count can go down. So clearly, we do not want to give a medication like this to somebody who has a mild or a moderate infection. But if somebody has a severe infection, somebody's in the hospital, then the benefit of this drug would actually make sense, because you're trying to prevent death. You're trying to prevent that person's heart from failing. So at that point in time, it makes sense to give this medication or other medications where we don't have robust evidence, but there's a possibility that they might be helpful. The one form of intervention that we have some data on and appears to be somewhat a good data on is what we call plasmapheresis. So what is plasmapheresis? Plasmapheresis is a process where you take antibodies from a person who has recovered from COVID-19, and then you give it to the person who's very sick with severe illness with COVID-19, so that these antibodies help this person recover. We actually have used plasmapheresis when we had the SARS epidemic. And the SARS virus and the coronavirus are very similar to each other. We also have data from China, Shenzhen Third People's Hospital, where they had 5 patients who were actually on ventilator and had complete lung failure. And when they had plasmapheresis, within 1 week, they actually showed clinical improvement. And so a lot of hospitals are now using plasmapheresis to kind of help patients who are having severe disease.
Can you tell us more about how to reduce the severity of infection?
So basically, there are 3 things that can be done to reduce the severity of infection. The first and foremost thing is reduction of exposure. So you know that healthcare workers get more severe infections. And the reason is because they're exposed many times during a day and for many days. So the greater the exposure to the virus, the more severe the infection is going to be. The second thing that we can do is optimal control of the underlying disease, which basically means that if you have diabetes, is your blood sugar controlled? If you have high blood pressure, is your blood pressure controlled? If you don't have your blood pressure or blood sugar control, your body is already under stress. Its ability to address another infection and another stressor is going to be very limited. So clearly you have a chance of getting a more severe infection. And last but not least, to build your immune system. And that is the key. So if you look at this slide, this is a very interesting and important slide. This is the coronavirus. And you can see that when it enters the body, it causes inflammation. And that inflammation causes fever, aches and pains, loss of appetite, and fatigue. If the immune system acts at this point in time, this person will recover without having much of a lung issue. However, if this gets into the lungs and the immunity kicks in, this person may have severe infection, but he will recover. But if the immunity does not kick in at this time, then the virus will go on to infect the heart. Now we know that COVID-19 can actually infect the heart, and it can cause direct damage to the muscles of the heart, and it can cause life-threatening arrhythmias. It can also cause kidney failure. So once you reach at this point in time, clearly you're going to be in ICU because you have multiple system failure, and your chance of or risk of death is very high. So the question is, what can we do to strengthen our immune system? Because that's a third way to go about it. And this piece of advice that's been given here is actually true. According to my research, laughter is the best medicine. Giggling is good for mild infections. Chuckling works for minor cuts and bruises, and snickering only makes things worse. So if you look at our immune system, laughter is one of the strategies to strengthen your immune system, but there are a lot of other variables which play a role. For example, what do you eat? Your diet plays a role. What is your degree of hydration plays a role. Physical activity plays a role. Sleep plays a role. How well are you managing your stress and anxiety plays a role. Smoking, directly inhibits your immune system's ability to fight infections. Social connection, how well supported you are, makes a difference. Nutrients in botanicals, multivitamins, actually definitely play a role to strengthen the immune system. So all of these things will determine how you will be able to deal with the stress of COVID-19.
You mentioned awareness tribe as a means of enhancing social connection and connection in general. Can you please tell us more about it?
So basically, when we asked our participants who actually registered, we found that the majority of them wanted to be part of a group where they could connect and they could work to cope with the stress of this pandemic. They wanted to work together to improve the immune system. They wanted to know what can they do to kind of help each other and help themselves develop themselves physically, emotionally, spiritually. So what we decided was we will create this awareness tribe. And the purpose of this tribe was that the people will connect on a weekly basis every Saturday at about 4 o'clock to discuss areas that are affecting them. For example, that will address the emotional issue, that will address immunity, that will address inflammation. So the first session we want to do is going to be next Saturday. And what we want to do, the purpose of that session is going to be to discuss how to strengthen the immune system. We'll talk about the relationship between inflammation and immunity. We'll discuss what is an anti-inflammatory diet. We will discuss how to manage stress during the pandemic and how to stay positive in uncertain times. So those are the areas that we are going to be covering in our next session. And we will be sending out details to everybody who has registered and who wants to participate in this awareness tribe.
Thank you so much. So at this time, I'd like to open up for questions. And it looks like one of the first questions we have is, can we transmit COVID-19 to our pets?
We have data which shows that there have been cases where COVID-19 has been transmitted from humans to animals. So if you have symptoms of COVID-19, definitely you have to maintain a distance. You want to make sure that there's no sharing of food, there's no licking, and if you are coming in close contact, make sure you wash your hands. If you are in quarantine, make sure that someone else takes care of your pet, because you definitely do not want to transmit the infection to your pet.
And our next one is, if you get it, then are you immune, or can you get sick again?
So when you get an infection, you do develop antibodies. And what we don't know is how long do the antibodies last. Definitely you will be able to not have another infection in 6, 8 months, 12 months. But we also know that immunity wears off, which means that over the course of time, you will not have those antibodies in your system. But what we don't know is how long do those antibodies stay in your system. So it's hard to tell how long that immunity is going to last.
If someone has one or more autoimmune diseases, does this make you more susceptible?
If your autoimmune disease is not controlled, for example, if you still have a huge degree of inflammation, if you still have aches and pains or other symptoms related to autoimmune disease, it's very clear that you are currently not completely your body has not been able to overcome the inflammation. And if it's not really there in its optimal state, another stress could definitely overwhelm it, no question about it.
Is IV vitamin C therapy a treatment option for COVID-19?
So I think that's a very interesting question. We know that IV vitamin C is one of the most powerful antioxidants, and it's very powerful anti-inflammatory as well. We have used IV vitamin C in our practice for a very long time for people who have chronic fatigue. We have used it for people with fibromyalgias. We have used it for people with low immunity, and we have seen tremendous benefit. We also know that there is data to show that IV vitamin C reduces the duration of cold. It can completely eliminate cold in people who are doing exertional activities, peak exertional activities like athletes, like military personnel. So there's no question that IV vitamin C helps. What we don't know is does IV vitamin help? Does IV vitamin C actually help those who have severe COVID infection? So there are at least 3 trials going on: one in US, one in Canada, and one in China, that is looking at the role of IV vitamin C in somebody who is severely ill with COVID-19. But because IV vitamin C has literally no side effects, I think it's really a good thing to kind of give it to a patient who has the infection. And if you have an infection early on, then you should immediately go for it, because actually that would help you overcome and not get into the severe phase of the disease.
Is the use of ultraviolet light effective for cleaning face masks?
Ultraviolet light C is one of the forms of ultraviolet lights that's actually been shown to help with sterilizing, because it actually destroys bacterial and viral DNAs and RNAs. So yes, UVC is actually something that you can use.
Thank you. And we're going to go ahead and answer a few more questions, about 3 or 4, and then we'll go ahead and see where our time is. So sorry about that. Are there statistics and data on how accurate an antibody test would be, sensitivity and specificity?
So it will depend on the type of test. Every test that is going to be developed will have different specificity and sensitivity, but it appears that it is possible that the antibody testing, the sensitivity might be more like 80 to 90%, as opposed to the PCR testing.
What if you have this virus but don't know it yet, and you're experiencing headaches and body aches, and you already took Advil a couple times?
I think you need to call your physician right away, because why the body is very sophisticated. There is a reason why you are having headaches, and there's a reason why you are having body aches. And especially if they're severe, you really need to figure out, and Advil is not something that I would advocate that you take. You take Tylenol. But the most important question is, why are you having that? Is it COVID-19? Is it something else that's going on? So the first thing is that you need to have a conversation with your physician, and you need to figure out if you should get testing done and what else do you need to do at this point in time. And as I have said before, the moment you have a symptom, please do not wait for something to become severe. Please, the moment you have a symptom, pick up the phone. Discuss it. What is going on? Could this be something you need to be concerned about? What can you do about it? Do not try to just band-aid your symptoms with medications. Please try to find out why are you having the symptoms. That's the best strategy.
If we test positive for antibodies, how sure are we that we will be immune? Are we still at risk for a different strain?
So that's actually a very good question. Once we test positive, it means that we have overcome the infection, and that's why we have developed those antibodies. Whether we are at risk for a different strain, we don't know the answer to that question. We do know that COVID-19 has 2 strains. And as we know with influenza, if you have one, if you remember when we talk about influenza vaccine, for the last few years, the vaccine has not been very effective, because the strains that were in the vaccine were not the strains which actually were floating during that season. And so it depends on whether the vaccine that we are developing, is it targeting both the strains of COVID-19 or only one strain of COVID-19. And depending on that, we can say whether we'll be protecting against both the strains or only one. And the same thing goes for antibodies. Whether the antibodies that we have developed, is it only against one particular strain, or is something that will also protect us against the other? Because remember that if you have influenza A or flu A, you can also get flu B, because they're 2 completely different strains. And that might also be the case with COVID-19. So in short, we do not know how protective will antibody against one strain will be against the other strain.
Should someone with an impaired immunity already seek to be immunized?
We do not currently have vaccines available, number one. Number two, right now you can enroll yourself in a trial. If you enroll yourself in a trial, there are also risks associated because we don't know what the issues are going to be with getting a vaccine. We don't know if it's going to be effective or not, and we don't even know what are going to be the side effects of the vaccine. So before you enroll in a trial, you need to be aware of that. So it's not like if you go ahead and get immunized, somehow everything is going to be perfect. That's why we are waiting for more information about the vaccine so we can make an informed decision as to whether we should get it or should we not get it. What are the benefits? What are the risks?
Are type 1 diabetics more at risk than type 2 diabetics?
It is not about whether you are type 1 diabetic or whether you are type 2 diabetic. The issue is how well is your blood sugar controlled. That will determine how good is your immune system. That will determine if you're going to develop a severe infection or not. Just because you have diabetes or just because you have high blood pressure does not put you at high risk. What puts you at high risk is how well controlled is your underlying problem, and also what other issues that you have that put you at high risk, particularly the strength of your immune system, particularly the state of the diet that you're eating. What is the degree of hydration that you have? What is the degree of stress that you have? How many hours of sleep are you getting? All of those things actually will contribute to deciding whether you will have a severe infection or not.
Is the ketone storm due to reinfection, or is it just an immune response to the first infection?
I'm sorry, I missed that.
Is the ketone storm due to reinfection, or is it just an immune response due to the first infection?
Ketone infection, ketone response.
Yes. cytokine.
Oh, cytokines.
Sorry, my apologies.
So is the cytokine response a result of what?
Is the cytokine storm due to reinfection, or is it just an immune response to the first infection?
Cytokines are basically inflammatory markers, and they are released as a response to inflammation. So infection can cause release of cytokines, reinfection can cause release of cytokines, chronic diseases can cause release of cytokines, gut issues can cause release of cytokines. Cytokines is your body yelling and shouting that it's inflamed, and it can happen with many, many, many different things. It's not specific to COVID-19.
And our last question is, when do you think quarantine will or should be over? And won't the curve spike again once we're out?
So basically, what infectious disease experts are saying is that if we can bring down the numbers by 70 to 80%, then that would be a good time when we can start thinking about slowly and gradually reducing the quarantine. And when I say slowly and gradually reducing the quarantine is basically that you want to make sure that you are not asking everybody to go out. You're making sure that the people who are at the highest risk of infection or severe infection are still protected. The people who are at higher risk of spreading the infection are still staying at home. So you will have to kind of measure that even when you find the rate of infection drop by 70% or more, at that point in time, you will have to figure out how you will allow people to get out of this quarantine in a way that you don't open everything up for everybody. You do it slowly and you do it very cautiously, because for those of us who are looking at the Singapore model, there was actually a revival of the infection because everything is really great and everybody started coming back out, and then there was again a spike, and then again when it was shut down. So it will not be an opening up for everybody immediately. It will have to be something which we will have to think about, and we will have to be very, very, very cautious about. And it will all happen after we've actually seen the curve actually reverse and reduction of infection rate by about 70 to 80%.
There's one other question that came in that I think would be awesome to address is, if you have it but have no symptoms and pass it along to someone else, will they also have a mild case?
No. No, because let's suppose you give it to somebody. So this is one of the issues with children, that children usually get a mild infection, which is a good thing, except if they are with the grandmother, and the grandmother is 80 years old and she has diabetes and high blood pressure and she is on steroids. Well, that little child, he will probably not even know he had an infection or she had an infection, but that grandmother will have this major infection because her ability to cope, her immune system was not there to be able to deal with this virus. So no, just because you don't have symptoms or you have a mild infection, it does not mean that the infection that you will give to somebody will also be mild. You cannot control that. That will be a direct reflection of the underlying condition of that person, as well as how strong is the immune system.
Thank you so much. And thank you so much for answering all of the questions, and everyone for attending. So I'd like to go ahead and thank all of those who have attended this webinar, and look forward to connecting with you in future sessions for answering more questions, and the awareness session next Saturday at 4 p.m.
Thank you, everybody.